So the AURIGA study, a Phase III study that enrolled newly diagnosed multiple myeloma patients who were MRD positive post-transplant and did not have any prior exposure to an anti-CD38 monoclonal antibody. So those patients were randomized in a 1-to-1 fashion to DR maintenance versus R maintenance for 36 cycles. And the primary endpoint was looking at MRD-negative conversion rate at 12 months. So that's kind of the design of the study. The primary analysis was presented at IMS 2024 earlier this year, and it met its endpoint, which showed an improvement of MRD-negative conversion for the DR group over the R group. And that was about 50-ish% for the DR group versus about 18-ish% for the R group. And so that was presented earlier this year. In this, at this meeting, we're going to present the different subgroup analyses, looking at different disease or patient disease characteristics, and also some high risk or cytogenetic risk factors. So in summary, I don't have to go over all the details, but basically in summary, across all the different subgroups, across age, race, ISS stage, the response upon study entry, and different looks at types of cytogenetic risk. So standard risk per the standard criteria and the revised criteria. We looked at that. We also looked at anticipating the IMS 2024 high-risk criteria that we expect to be published later on. We looked at patients that way too. And across all those different subgroups, it looked like the addition of Daratumumab to Lenalidomide maintenance seemed to improve outcomes and seemed to improve MRD-negative conversion rates at that 12-month mark. Also looking at different age groups of like less than 65 versus 65 and older, there was no real difference in the time on treatment. The median duration of treatment was about 25-ish months, and there were no differences in the safety occurrences. So in younger patients versus older patients. And same thing with the Black population, so that was nice.